The only way we can really identify all these mutations in our patients in an efficient way is with next-generation sequencing. Even at my own institution, we've had a big evolution in how we test patients. A number of years ago, we started just testing for EGFR mutations. We recognized that KRAS mutations were important, and so we tried to do an analysis that combined EGFR and KRAS. And then over time, we saw BRAF was important, so we added that on. And then we learned about ALK and ROS, so we had to do FISH testing for those two things. So we did mutation testing, and then we did FISH testing, and it kept our pathologists quite busy. And probably the most important thing, though, is we ran out of tissue. So we did the mutation testing for a handful of things, and then we went to do ALK FISH testing. We got that done, but then we went to do ROS. There was no tissue left. And so we couldn't test for some of the key things that we really cared about and we thought would help our patients. Moving forward, we went to a next-generation sequencing panel. Next-generation sequencing is an amazing platform that allows people to sequence hundreds of genes on a very small biopsy specimen. As you know, most of us, when we diagnose a patient with lung cancer, the most we can get is 1 or 2 core needle biopsies. When we go to test for mutations, we run out of tissue on that. But if we use next-generation sequencing, we can identify mutations in hundreds of genes and get those results. Probably the biggest challenge associated with next-generation sequencing, though, is understanding the results. You have hundreds of genes, and you find mutations in things that you've never heard of, and you don't always know exactly what to do with that. Some next-generation sequencing providers will provide interpretation of the results, and sometimes the interpretation is a bit more open to a disagreement than I would like. So I think that there are a number of things that we can target based on prospective phase 2 evidence showing a drug works. And if we kind of draw our line there, next-generation sequencing is extraordinarily valuable for identifying all those mutations and making the best opportunity for your patient. If we go on to some of the more esoteric mutations and things that for which we often hear everolimus is recommended, that's probably not the best approach.